So welcome everybody to the IACT IMDHA presenter series. We are getting all geared up for the HypnoExpo 2021, which is May 21st through the 23rd. That's the weekend, mind you, but before and after the weekend, there are pre and post conferences being given in specialty topics. And that's exactly what this series is about. We're interviewing, talking to the people that are doing those pre and post conferences. Tonight, we have a couple of guests. We're going to start out with Patti Scott and Eric Rosen, talking about their medical hypnotherapy certification program. And then after that, we'll be talking to Will Horton about his ultimate NLP course, which is a 2-day pre-conference as well. So you got any announcements or anything that you need to share, Karen? Welcome everybody. My guest host, or my host, co-host Sharon here, or Karen. I remember your name. So
I think some editing is going to need to happen in post.
Yeah.
I don't have any announcements to make. Hello, it's good to be here with all of you tonight and good to see everybody.
Okay. Well, then we are
My name
ready.
is Karen Hand, by the way. Karen Hand.
Karen Hand. Karen, yes. Exactly right. So, and you got that right, Karen, and I'm so glad that you did. So let me introduce
one of us has to.
Our first presenters that we're going to share with you tonight, I mentioned, are Patti Scott and Eric Rosen. They're going to be presenting a 2-day program on medical hypnotherapy. And I got two people to introduce here instead of one. So first of all, Eric Rosen, I want to talk about, because this guy has got so many credentials. It's outrageous. He's an adjunct faculty with the Florida School of Professional Psychology at National Louis University in Tampa, with some specializations in pediatrics, child and family and couples work, school psychology, and clinical hypnotherapy, with a master's certification for teaching, IACT and IMDHA, of course, working with special needs populations, including the deaf, blind, ASD, intellectual disabilities, learning disabled, and ADHD. So much, and pardon me for reading, but there's just so much I couldn't possibly remember all this. And he's fluent in American Sign Language. He's a certified trauma professional, and he does forensic work in areas as expert witness. Let's see, parental fitness, competency to proceed, and criminal responsibility cases. And Eric also has a diplomate fellow in clinical psychopharmacology. Now, there's a big word, by the way, if you're ever playing Scrabble. He has awarded an International Educator of the Year award by IACT for hypnosis teaching in 2018, and the Lynn Grove Keys to Excellent Award in 2019 by the Hypnosis Education Association here in Florida for his contributions and accomplishments in the field of hypnosis. Oh my gosh, I have to take a breath. So, Eric, we are just really glad that you're here with us tonight. So let me just say hello to you quickly, and I will introduce Patti. But hi, Eric. We're glad you're with us.
Glad to be here.
Yeah. And Patricia Scott, I got to tell you, I needed to introduce, I called Karen in advance, or texted Karen in advance. I says, I've got to introduce Patti Scott, because this is a lady that I have known over 20 years now. And she just continues to be a real a beacon, a spark, a bright spot in my life. So, Patti, you know that I love the heck out of you. Patti moved to Florida about the same time that I did. And one of the things that I want you to know about her is that she got involved in a way with her local community that built a business so impressively. I'd never seen anybody do that so well. So I know it's not the thing that she's here to talk about tonight, but I want you to know this about her, because she's somebody who you might want to take to lunch or something at some point in the future, and find out just how she did all of that wonderful stuff that she does. But she's also a certified medical hypnotherapist since 1992, as a matter of fact. She is a master trainer for IACT and a life fellow with IMDHA. She's the president of the UP Hypnosis Institute here in Florida, UP standing for Unlimited Possibilities. I was really fortunate to do some training with her for a number of years over there, and it's just such a great program that she has. She's let me see, hypnosis in Florida. She maintains a private practice, of course, and she teaches hypnosis, medical hypnotherapy, and NLP. Prior She had a 20-year career as a professional singer, actor, dancer, and songwriter, and a talented lady she really is. So, Patti, I'm delighted that you're here. Say hello.
Hello, everybody, and I'm free for lunch anytime.
That's great. So, medical hypnotherapy. Now the program that you guys are doing is Wednesday and Thursday. It's the 2 days prior to the weekend. That's the 19th and 20th of May. So mark your calendars, everybody. and let's just go right after it. Who is this? Who is your medical hypnotherapy course designed for?
Well, it's designed for people. First of all, you mentioned certification earlier. I just wanted to clarify the 2-day training is a specialty training in medical hypnotherapy. So the 2 days that we're doing pre-conference, I believe it's the 19th and 20th. I forget the dates.
That's right. Yeah.
Anyway, it's the Wednesday and Thursday before the conference is designed for people who are familiar with hypnosis. They don't have to have any particular number of hours, but it's designed for people who are familiar with hypnosis and who would like to get more into helping people with medical issues specifically for getting into that. So the certification is a optional post-conference that we offer because it requires more hours. And for people who maybe aren't already members of IMDHA, it also we require a 200-hour prior training in hypnotherapy for that. And then there's additional cost to some online training that would then give them enough hours to be able to join IMDHA. That's why we came up with that 200-hour minimum for the certification. But to get the 2-day training, they will get a certificate of completion in medical hypnotherapy.
Okay, and if I'm already, pardon me, if I'm already a member of IMDHA, can I take your course? Is there's something further that I need to do to get certified, or no?
This would be a specialty certification specifically in medical hypnotherapy. Yeah.
Got it.
For people who are already with IMDHA, and if they're not, then like I said, we can give them additional hours so that they can join and then become certified through them. And I also give them a second certification in medical hypnotherapy through my institute, Up Hypnosis Institute. So yeah.
So medical hypnotherapy, it brings all kinds of ideas to mind, you know, and just to be clear about it, what exactly does that involve? What is medical hypnotherapy, and how is it different from other forms of hypnosis?
Well,
Eric, you want to grab that?
Sure. I'd also like to say that the course is particularly pertinent for certified clinical hypnotherapists through IACT, IMDHA, and also for licensed mental health therapists, licensed psychologists, social workers, nurses, who are also part of IACT certified clinical hypnotherapy and IMDHA. So that the reason we put this together, and I have to also acknowledge what Michael Watson said, that Patti Scott is truly a spark, because this whole formulation has come about because of her innovation and our discussions. And I feel privileged having worked with her for all these years, that we find that many people are in need of complementary and integrative services that clinical hypnosis provides. And there are many practitioners, medical practitioners out there that are looking for these integrative services, particularly to help with pain issues, to help with pre-surgery confidence, even part of the healing process. The research shows that post-recovery, for people that are more relaxed and able to get into some of these messages that happen through clinical hypnosis, really activate the healing process. And so we put together a course that we feel is a wonderful marketing tool for people that are in practice doing clinical hypnotherapy, and it also helps to sharpen their skills.
Now, if you got some...
I'm sorry. I find that fascinating, Eric, because I thought medical hypnosis involved dealing with patients of some sort, not that you would call them patients necessarily, but people who have a diagnosis of cancer or people who have some other diagnosis like that, and you would be working with them hypnotically on that score. You just broadened out the definition completely from what I had imagined it might be.
Well, there's a host of, when we add the term medical, it really gets into wellness. It gets into how people take care of themselves. When we blend the medical aspects, we can think of all the countless ways that people are seeking services medically where clinical hypnosis can be a help. Take, for example, somebody who is diabetic that possibly is having difficulty with mustering the continuity to take their medication, to monitor their nutrition, to be able to generate some healthy exercise. And so hypnosis is wonderful because it gets at the core of motivation to get people really energized.
Yeah, and in fact, when Karen mentioned, or I guess you mentioned it, like pre-surgical anxiety, things like that, which is a whole different deal than with illnesses directly. And it just occurred to me while we were talking about that these days, this week, this month, the next couple of months, I wouldn't be surprised if there isn't an increase of people, and maybe maybe they get referred to us from the medical community who are dealing with anxiety about injections. Yet another but is that medical?
Let me jump in on that as well. Talk about our circumstances of living in a pandemic and having to now mask. I've worked with people to help promote confidence and comfort with being able to wear a mask, because for some people it can be very claustrophobic having this over their mouth and their nose. And particularly for people who may have had abuse and other types of life circumstances where covering their mouth can be incredibly anxiety producing. And hypnosis works.
Sure. Yeah. And it's funny because I'm one of those people. I really hate wearing a mask. I do what I'm supposed to do, but I really hate it. It's just weird to me. However, what I found is online, of course. Here's the way that I do it. I've got the mask on my microphone, and that makes me feel entirely safe.
Michael, I might also mention that when we're talking about anxiety, one of the things that we do get into in the training is scope of practice. We're very careful to talk about things like that. So there are peripheral issues. There's a fine line between stress and anxiety. Anxiety is a clinical term, it's a medical term. So we want to make sure that the people taking this course get a quick education in how to work with medical referrals when they're necessary, and also how to go ahead and figure out if there are some peripheral issues that the client is dealing with. Let's say they're coming to you for weight issues or for smoking or some other thing, and you start to discover, well, they're having sleeping issues, or they're having headaches, or they're having some other clinical thing. We can have that discussion with them and maybe expand on what we're able to do with them by getting that medical referral. So we cover scope of practice. We're very careful about, like Eric was saying, it's about integrating the integrative medicine, which is, I love that term now, because that really is what it is. We're a complement, we're a partner on the team, the medical team. And I believe that part of also what we cover in the training is how do we introduce ourselves, and literally, I think it's our job to educate the medical professionals in what are we as hypnotherapists, as someone trained in medical hypnotherapy, what are we able to offer their patient, and for that physician or that mental health counselor, whoever it is, the licensed person, dentist, that can actually help make their job easier, and to make sure that we cover scope of practice and all of those things, and how we can expand in an ethical way into being a integrative team member. And that's our little 45-minute talk, I believe, is on Sunday, is about, it's a very short, but it's going to talk about also that, about how we can expand and let people know that, that we can be part of the team.
That can be a daunting task. Some hypnotists are even afraid to talk to doctors, or say, no, they'll just shoo us out of the office. They don't even want to approach it. So the fact that you're going to give insight into how to approach that and educate is a really valuable part of this course.
And when we talk about the scope of practice, which is essential, it's also understanding where we don't go. In other words, we're not saying that what we're doing is competing with conventional medicine. We're not doing that. Actually, what we're doing is supporting it, but helping people to live better lives, living with what they live with. One of the things I was thinking about is that notion in the hypnosis courses that we teach, we talk about ID, that internal dialogue. I think that ID part is something that when we deal with a medical condition, we start to feel like that is us. And that is not us. We are somebody, we are a human being who is holistic, that lives with something that we have to come to terms with, to deal with, to live with. And the hypnosis can get to some of these core issues to help people to feel that they're more than their illness.
And then thereby making it easier for the doctor to do the doctor's work. What a lovely thing that is. Eric, when I first moved to Florida, the first client, either first or second, I'm not quite sure. The jury's out. But one of my first two clients was a surgeon who was having panic attacks in the operating room. So he sought out a hypnotist, which is very wisely done. And not only was the work successful, but it became through him the source of a whole lot of referrals, because it was truly convincing to him. And he refers me to other doctors then who start sending people to me. So, I know there are people that think that the medical community doesn't like us, but I don't think that that's true if they have the appreciation that we are collaborators and that we respect what it is that they're doing rather than trying to invade their turf.
Right. And that's the important point that we make in the training is about that scope of practice, how to introduce ourselves to the medical community and through our clients sometimes, and to be able to let them know, what part we can play in the overall wellness of their patient. And I think that's our role. I have a video that I just put out from actually 2017 when I had oral surgery or periodontal surgery, I was told is the correct name for it. And I've talked about it for years in these trainings and things. And I finally did an interview, a follow-up interview with the periodontist that performed the surgery. And I've got it out on YouTube now. And it was really educational for both of us. And one of the things he mentioned to me was that he was just absolutely flabbergasted about, how I didn't have to, he said, I asked you, let me know when you're ready at the beginning when he came in. And I said, I'm ready now. And he couldn't figure out how that could be, because he thought I had to put myself into some kind of a deep trance. So it's interesting how the perceptions and a lot of what we cover is listening and how to explain these things, even to someone educated, as a medical doctor, can have some strange misconceptions or some inaccurate, at the very least, misconceptions about hypnosis. So I think that being able to talk intelligently and, as an informed medical hypnotherapist, to know what kind of language to use. Eric does a whole segment on the DSM, the diagnostic codes. And, we don't have to learn all those codes, but to be able to speak from a place where we know what is it helpful for us to say to this medical professional that can let them know we know our expertise and how it can fit in with what we respect is their expertise. And to be able to enlighten them and allow them to become aware of what our role can be with, like you said, anxiety, pre and post-surgery anxieties. The periodontist mentioned on the video that I'd totally forgotten. He said, yeah, and you didn't take any pain medications and there was no bleeding, no hemorrhaging whatsoever. Things that I'd forgotten because it was a few years ago. And it was so impressive to remember how well that went. And like I said, I encourage always people that are doing this work, do it for yourselves. It gives you, you're your own guinea pig. You get great stories to tell other people. And even as far as telling, also you're not just your clients, but the medical professionals that you interact with, both socially and professionally, in order to have some real solid background of some true stories with yourself and other people. And I think that's very helpful in this field, is just to have practical experiences. I know Eric in our training, he's always telling such great stories about the patients that he's had. And some of the real life examples, I think, are very educational for the people that are doing this, to allow you to know that we can learn this, that you're going to be working with the emotional and the physical anyway. When you're working with someone with hypnosis, you're automatically going to be affecting those areas, even if you're working on something that wouldn't require a referral. So it's nice to get a little more education, I think, in that realm.
I'm curious about the medical codes. Eric, does that qualify a hypnotist to then bill insurance, or at least provide something to the client so they can turn it into insurance?
No, that actually depends on the licensure somebody has in the state that they're working in, on whether or not, if they're getting into actually even diagnosing. That maybe it's more reserved, I think, to licensed individuals working in some medical aspect or in some mental health capacity.
So that really is for the hypnotist to inform them when they're talking to doctors, so they will sound like they know what they're talking about in that realm.
Part of what we do in the course is the reason why I think knowledge is power, and it's also knowing how and where to use it. And so if we understand that somebody's coming in and they tell us, I've been diagnosed with anxiety. Well, we always ask the question, well, tell me more about that. Did somebody diagnose you? What is it? What's your understanding of it? But what we teach in the course, if somebody comes in with that type of label, and we don't believe people are labels, that's another message in the course, is that we teach people how to unpack, that's the terminology, to unpack if they are talking about diagnoses. So we actually help people with some different hints and clues and tips, strategies, so that if somebody comes in and they say they deal with anxiety, well, it might lead us, even in the interviewing and the dialogue we have, to inquire about, well, tell me, where does it show up and how do you experience it? From that, we might discover, wow, that they're having difficulty with driving, and the driving turns into panic attacks, and the panic attacks, which we teach about, could happen on a bridge, which then leads to phobias and fears. Oh my gosh, clinical hypnosis can target all of those different areas to create relief for people. So the course helps you to unpack what people are telling us. In fact, another unpacking I'll throw in there that we love to teach about is that it comes out of health psychology. And that's the notion that whatever medical thing we're having, it has to do with the meaning of it. How do we experience it? In other words, and we talk about this in the course, I work with people that also have MS. And I worked with some people in the past where what I discovered is that it wasn't just the symptoms that can affect muscle coordination and memory and vision and so forth, which we talk about, but it also was, how did it affect your identity? The feeling of being broken, the feeling that you weren't attractive and you weren't worthy and that you couldn't find somebody who could love you. That's where hypnosis comes in, because it can heal those things. It can change how we experience ourselves, even dealing with a medical issue.
Yeah, all of
Eric,
you.
how did you make the leap to hypnosis?
Me personally?
Yeah.
Well, actually, when I started years and years and years ago, a friend of mine said, you have to come to this workshop. And it was taught by John Grinder. And so it was NLP, clinical hypnotherapy, with an Ericksonian twist. And I just fell in love with it. And meeting Patti kind of reawakened all that for me. And that's how I've gotten really just completely inundated with it. But I will tell you that as a practicing psychologist, I don't use hypnosis for everything. In other words, everybody is not a nail and hypnosis is the hammer. I use it where I feel that it's going to best help people. And for people that do practice with clinical hypnotherapy, we want to give them all the tools possible.
Your personal background into making that leap to hypnosis is going to bring a lot to this class, because you had to come from that background of, wait a minute, this is hocus pocus stuff, and then learn about it. So you speak from real experience to help gain that understanding.
And I will tell you that I go through this every time I use hypnosis. And that is, I marvel at how powerful a tool it is and what it can bring to people's lives. And traditional clinical psychotherapy can do wonders. I find hypnosis fills in the gaps, and it does it in just a seamless, beautiful way. And that's what I bring, is that passion for when it can be helpful. And we give lots of redacted, I will tell you, the redacted case examples to preserve people's confidentiality, but I want to flood the course with lots of those redacted examples so they can see that this really works for people.
I kind of want to point out as you're talking about this, I'm sort of in awe at the idea, the fact that you and Patty are doing this together represents the bringing together of, gosh, like, 6 or 7 decades or something of experience between the two of you. That a lot of times, we see courses and the thing that I love about IACT and IMDHA is the caliber of people and the level of skill and experience that they have. So well done there. When did you guys start doing the medical hypnotherapy course? How long have you been doing that?
Well, I actually started a 2-weekend course in medical hypnotherapy quite a few years ago. I always knew I wanted to get into that after I became a trainer of hypnosis. I always knew I wanted to teach the medical side because I started in the medical my first year, 29 years ago in hypnosis out in California, in Arizona. And so I knew I wanted to teach the medical side, and to do it specifically. A lot of the places where I studied are no longer exist. And a lot of the teachers that I studied with are no longer in this world anymore. So I knew I wanted to continue to teach, to teach the hypnosis students I had and to teach them some specialties. So I started it, and actually I brought in another person to do the first weekend. It was Melissa Roth at the time. I had known her from being someone who was very, in the medical side of hypnosis at the time. So she did a weekend, and then a week or two later, I did a weekend to kick it off. And then it had been a couple, 2 or 3 years. And I think in the meantime, I had met Eric Rosen, and we got really excited meeting each other and talking about hypnosis, of course, and all the different things. And for years we conversed. And then when he came into the training, when I started doing it again, I thought, oh my gosh, he had such a wealth of a background. And again, adding some segments on the DSM and health psychology and all these different things. And it just expanded really quickly once we got together. And I'm a perpetual student. So you're talking about learning things at this conference. One of the things I love about hanging out here at these conferences is because it is an education every time that I'm in the room with any of these wonderful presenters. And every year the presenters get better, the same presenters get better and different, and I learn something. So to me, teaching is also a way of learning. And last year and the year before, the students that we had at IMDHA with this training were from all over the world. And they added to the quality of this course by their feedback and by their different comments and the things that they brought to it. So one of the things I did find out that I would like to mention a little bit off of the medical is that when I was teaching this training the last couple of years, it became very apparent that some people who didn't train through IACT and IMDHA that were moving on to do the certification training that, supposedly had 200 hours of training, that there were so many of the basics that we get through IACT and IMDHA that they didn't come into the course with. And I ended up finding that there were some real basic things that we were able to introduce people who'd been doing hypnosis in some cases for a long time, many years. And it would be something new that to me, I just took for granted because I started out learning it at the beginning. Yeah. So again, you can always keep learning and learning nuances of what you already know. And but to me, it was evidence that IACT and IMDHA kind of has, at least in my opinion, a little bit biased maybe, some amazing trainers and amazing opportunities for learning at this conference, and with all the things in between, the virtual chapter you do and all of the other things that are offered by the people that are drawn to these organizations. So I think that's a real plus in just being exposed to what they have to offer.
And as we said earlier, brillianter and brillianter, right? It seems that all of the work that we do teaches us something else and allows us to take it a little bit further, which is why I appreciate when somebody has a course that they've developed over a number of years, because it just keeps getting a little bit sweeter every time you do it. So moving from where you started, you've got this lovely course that you're doing now. Where is this headed in the future? What do you see as the future in medical hypnotherapy?
Well, I see it expanding even more, because the course that we teach, the 2 days, obviously is a good starting point to get people really excited and give them some good solid tools to start with to expand what they're already doing with hypnosis. The certification, again, takes that to the next level, in my opinion, and to start really specializing in pain relief and in immune system hypnotherapy and in addictions hypnotherapy. And there's a lot of great people out there doing some of these specializations. I think you can take any small element of medical or clinical hypnotherapy, and there's no limit to how far you can expand that specialty. And again, as many trainers and ways you can do that. So that's for this course. And we've been doing this all along. Eric and myself are always adding pieces, and expanding on it. So there will be a time when there will be whole modules or whole weekends, perhaps, that will be dealt, getting out into other specialties that are related to what we're teaching in the basic medical hypnotherapy training.
Yeah.
What do you think, Eric? What's in the future for us?
Well, absolutely. I think we're moving more toward an integrative approach where, understandably, by recognizing scope of practice and where the benefits of hypnotherapy can come into play here, one of the accents I think also in the course and where we're going is that I think it becomes a wonderful pocket of where you can deliver service. In other words, how do you market this? And where would you market it? Is it possible then you could take a certain type of medical condition, let's say diabetes, and you could market to endocrinologists, you could market to primary care doctors, and you could work on improving wellness and compliance with treatment. And hypnosis can do that. So that's another aspect that the course provides, and where I think we may and can get to as a profession, where they will see us as allies as opposed to competitors or something voodoo-y.
Yeah. And as I mentioned earlier, I think my experience is that however it is that I approach medical people is how it is that if I've got a fear that they're not going to receive me, well, I'm probably going to be right about that. And unfortunately, that's not my experience. I think the idea of and really good for clients, by the way, the idea of being a part of a team is I think a real important thing. So here's what I wonder. I've been hallucinating as I prepare for this conference. I always sit down and think about going and who am I gonna see there, and it's really funny because for some strange reason, I keep forgetting that we're going to be online. So I'm imagining down the hall, all the things that we do. And I'm also imagining, and I understand that it's just my imagination, but I'm imagining opening the door and walking into your classroom while you're doing this program. So if I could do that, and of course, virtually, that's what we're going to do. What's it going to look like? What'll be, how is the class, what's the class like? How will it be set up, and what can you tell me about it?
It's going to be, conversational, with PowerPoints and some things like that, but it's very interactive. We definitely do breakout rooms. We definitely do, demonstrations. And like I said, a lot of storytelling and things like that, stories about experiences and examples. And yet it's very interactive. And I mentioned many times before that our training isn't a cookie cutter. It's not, it's not like here's step 1, 2, 3, because hypnosis isn't like that. So I learned years ago, when we're training, we adapt to our audience. We adapt to the people taking the training to make sure that each person in that training gets individualized attention, respect, and that they all walk away with something that specifically for whatever their expectations were, which we start off, with that. What are your expectations taking this course? To make sure they all get something that they can take back to their communities, to, in the case of these conferences, to their country, spread it around the world, and to be able to take away and expand then even more. And we keep in touch with the students, and I do follow-up interviews sometimes with them, and to really keep allowing the medical community to be more and more involved and respectful of what we can offer as part of the integrative healthcare team.
Nice.
I think it's impressive to be able to add what you're offering to the conversation you're having with doctors, because I remember early on when I was a baby hypnotist talking to a hospital about, let me come in and do some stress relief hypnosis for your folks. And the response I got was, oh, we have people on staff who can do hypnosis. you know, and they had some psychologists who did it once or twice or took a weekend course. But as you talk to them about having the same level of training, now we're not going to have 8 years of education in college, but when they see there is advanced training and specializing in this, I think it draws their attention more. I think it draws the respect a little bit more. Would you agree?
Absolutely. Yeah, and like I said, for the certification in this, there are outside assignments that are required. There's writing examples of writing scripts, analyzing scripts. There's listening skills portions. So it really is it's very well from the comments from those students the last couple of years. It is extremely comprehensive for the amount of time that's spent on it, and that's what we want. Is for people to get really excited. And also the other part of it that I was hearing a lot over the last years that we've been doing this is the confidence level that some hypnotists are kind of afraid to touch on those medical issues. And what's happening, I'm seeing, is that they feel confident. They feel, standing a little taller when they're in front of that doctor or that medical professional to be able to say, here's my expertise, and let me explain to you something about how this is helpful for your patients, how I can actually help your patients to have a better experience with whatever treatments they're already getting. And it allows you to be respected by the doctors, to come from that place of confidence, of really knowing. And I always say we are all ambassadors for this field. I love using the term hypnotherapist. I will always use that term. And knowing that when I do hypnotherapy, I always get a referral from the proper licensed professional. And that's great. I want that connection. I want that communication with that person. And that's how we expand our practices too. So to me, it's about gaining confidence and just realizing if you know how to do hypnosis, you can learn just with some nuances of language and some awareness of scope of practice and the things that we touch on in the course, that you can walk out of there knowing I'm really excited now to go out into the medical community in my area and present myself as the expert in this, that I can help people, and this is valuable. So
nice. Yeah. Listen, I'm noticing that we're only about 6 minutes away from the end of our time with you. So I want to make sure that we get in anything that we want and we don't leave questions unanswered. So just to let everybody know in the audience, we have muted all of y'all's microphone. All of y'all's. I'm really in Florida. We've muted all of y'all's microphones, but you can unmute your microphone down in the lower left-hand corner of your screen. Probably you'll see a little microphone with a red circle and line through it indicating you're muted. If anybody has any question that they'd like to get into the discussion here, please feel free to just open your microphone and shout it out. We'd love to hear from you.
Michael, this is Chris in Albuquerque.
Hi, Chris.
Hey, Patty, I was kind of curious. I know that you're doing the 2-day, you and Eric are doing the 2-day class at the conference. I'm interested in the full certification. What would that involve? I'm an IACT member, have been for quite a few years. What would that include? What does that involve after the conference?
Yeah. And again, the 2 days is a all-encompassing course in itself. It's designed to be a course, and there will be a certificate of completion for the 2 days of specialty training in medical hypnotherapy. For those who want to become certified, because of IMDHA's high standards, frankly, we've got it to where then anybody who wants to continue will, let everybody know post-conference, not meaning after, during the conference, but later online. Eric and myself will be conducting online further training, online courses. With COVID, it'll still be online, and some outside assignments, including working with some outside clients, doing write-ups, some exams that are required, and those kind of things. And it will bring up the hours to the level that IMDHA requires in order to be certified through IMDHA as a certified medical hypnotherapist. So anybody that takes that will need to have, which you have, obviously, you're an IACT member for many years, you said. So you would, they would be required, the people in the last part of the course that they're going to continue, and there is an additional fee for that, would be people that have a minimum we require a minimum of 200 hours of formal hypnosis training with a reputable organization. Doesn't have to be IACT, but I'm finding it's better if it's IACT, frankly, like I said, but that's just my observation. But if they have 200 hours of training in hypnosis and they're current, and they didn't do it, 50 years ago and haven't done it for 20 years or something. So that they'll be able to move pretty quickly during our training. And then Eric and myself would do, like I said, some more online hours, and it's quite a bit more training that's required, but it ends up being considered a 50-hour course in medical hypnotherapy for certification at that point. And you would get 2 certifications.
And then there's
through my company and through IMDHA.
And you guys, is this an ongoing class that you teach, or is there like you're going to post the schedule for it, or let us know when that would be?
Yeah, during the course, and it's on my website, but I do an outside course aside from the one I do at IMDHA. I do an outside course also for certification. If they're already IMDHA members, when they take my course, there's some additional benefits that I will tell you later. But they have to be an IMDHA member in order to get that IMDHA certification in medical hypnotherapy. That is a requirement for that.
Okay, so I'm just a member of IACT, not of IMDHA.
Yeah.
That I would have to
I'll
join
be-
that, or
yeah.
I'd have to
This
qualify.
would give you enough hours to join. If you choose to join,
Got it.
there's, like I said, there's some other benefits I won't go over here, but my company makes it real beneficial for the people in the course, even the one that I teach separate from the conference, to join IMDHA sometime during the course.
Okay.
I make it quite beneficial, and that would be apparent later. But yeah, and you don't have to do it right away. If you decide to join later, you could join IMDHA and ask for that extra certificate, which there's an extra charge for that, like
Yeah.
I said. So
Okay, thank you. Thanks,
yeah.
Michael.
All right. All right. Anybody else have any questions for Patty or Eric? I hear.
Well, keep in mind that they will be giving their course, Medical Hypnotherapy, on the Wednesday and Thursday prior to the conference. It is a pre-conference event. So don't wait till you're sitting in one of the classes at the conference to look for the medical hypnotherapy thing. It will have already happened. Go look for it now and register now for Medical Hypnotherapy with Eric Rosen and Patricia Scott. I think it's going to be tremendous. Sounds.
And we have a lot of fun too. It's not all serious.
I'll bet.
Hypnosis is fun.
Nice. All right. So and by the way, just one more time, what is the 45-minute or 50-minute, whatever it is, lecture that you have as well during the weekend, Patty?
We're talking about medical hypnosis essentials to expand your practice. I don't remember. I don't have it in front of me, but it's a little encapsulated thing to get people excited about learning more about the medical side of this field, because it is so gratifying and so helpful.
Well, ladies and gentlemen, Patti Scott, one of my favorite people to hang out with and to get training from, who has always been an inspiration to me, and Eric Rosen, who is just such a great practitioner and addition to the team. Wednesday and Thursday, the 19th and 20th, medical hypnotherapy at the IACT IMDHA HypnoExpo. So be there or be square, as they say, because it's just going to be wonderful. We are running out to the end of our time. So officially, Patty and Eric, I'm gonna say goodnight to you and thank you for being here with us. But
Thank you.
Please do
Thank
hang
you
out.
very much.
Patty and Eric, thank you so much. Wonderful job. Thank you.
Thank you.
Thanks.
Thank you.
Folks, their lecture is Saturday at 11.
Oh,
Free lecture at the conference.
Oh, I thought it was Sunday. Thanks for telling me. I hate to miss it.
Great job, guys. Great job.
Great.
Thank you.
All right, so I'm just